Hey, beauties, what's up? Thank you for tuning in to another episode of Let's Ask a Surgeon. My name is Larice, and I am your host and the founder of BeyondBody.com. On today's episode, we are going to be talking all about belly buttons. So let me add Dr. Laverson to the screen right now. Hi,
Hi,
Dr.
Larice.
Laverson.
Hi, good morning. Good morning.
How are you?
Larice, you got to let everybody know it's beyond body, but body is BODIE, so they can find
Yes.
you.
Yes. Look at there's a story behind it. BODY was taken when I was trying to get my website up. So I had to get creative and think of how else can I spell this? So that's how it became BODIE, everybody.
Yeah,
Yes, thank you for mentioning that, Dr. Laverson.
excellent.
So today we're talking about belly buttons. I'm super excited. Like, who would have known belly buttons were like the thing to talk about, right?
Yeah,
So we're going to start off with the first question. It is, if your belly button is the same from birth and all you're doing is making a new hole in the skin for it to come through, why does the shape change from its original shape?
excellent question. And the reason there are several reasons that may happen. Number one is the opening the surgeon creates for the new belly button may be a certain shape. So the opening the surgeon creates will affect the shape of the belly button. The other thing is that the tummy tuck, when the skin is being advanced or repositioned or pulled down, there's tension in that vertical direction that wasn't there before, and that may verticalize the belly button a little bit. Even if the doctor makes a round hole, well, that becomes an ellipse because the skin around the belly button is being pulled. It'll pull it into a certain shape. So,
Mm.
and then there's another thing. The operation is done with the patient laying down, and um, it's the doctor has to understand locate where the stalk is, where the belly button is on the abdominal wall underneath that flap, and make an opening in the abdominoplasty skin that's been moved, and then put the belly button in. But when the patient stands up, what if that skin moves up or down? Well, that's also going to change the direction of the belly button, maybe the shape of the belly button. So it's sort of a combination of things.
Hmm. Okay, I feel like you kind of hit on a couple of the questions that were coming next. So the next question is, do you, Dr. Laverson, have a particular style when it comes to, the shaping of the belly buttons? Like, do you go for a certain look?
Okay, that's another great question, and the I there are two things mainly that go into my plan. Number one is what if the patient expresses a particular desire for their belly button. I take that into account, and that's what I want to have. If they say they want, I mean, I had a girl once said I want a penny slot belly button, like a penny slot, and vertical, narrow. So that's what we do, and then there's a study. It was done by a really good surgeon in the Midwest somewhere. I remember it was a while ago, but this doctor looked at did a survey, okay, among the general population. I'm not sure if it was women and men or or what, but basically the study was this: they showed a bunch of different kinds of belly buttons, different appearances of belly buttons, and had the observers rate the belly buttons from like the best to the worst,
Mm.
probably five categories. And their conclusion after the study of many people looking at all these different kind of belly buttons was the favored belly button aesthetic was a vertical one, a vertical ellipse, and sort of a T-shaped one with a little hood over the top, like
Mm.
vertical with a little T shape. So knowing that those are sort of the favorite appearance, I'm going to try and go for something like that. But then the third thing is, Larice, beyond body, is that if the woman is their particular build, okay, if a woman is like extremely lean and thin and there's no fat there, you're not going to have a deep belly button, and you sort of want to make a belly button that hides that scar around. So it's harder to hide it inside the stalk when the woman is super lean. If the woman's thicker, there's a little bit of a fat on there to hide the scar in. Um, that's sort of nice to do, and I do this inverted chevron sometimes, meaning
Mm.
so the scar doesn't show on the bottom. The scar is easier to hide in the top because the skin around the belly button hangs down, and that scar tends to be buried. But the one on the bottom is the one people really see if it goes right across there. And of course, you don't want it to look like surgical. You want it to look natural. So sometimes I'll do like what do you call it? Like a little arch shape, a
Okay.
high arch, so that there's no scar on the bottom where it's most visible because the light shines on the bottom of the belly button.
Okay. I can't believe someone actually asked for a penny slot. I feel like that's the most seen tummy tuck belly buttons is that little thin piece of it's not even a belly button. So
Yeah,
for someone to just ask for that, wow, okay.
yeah,
Look, to each his own, I guess. All right. So our next question is, how is the belly button detached from the skin? Like, do you like electrocauter electrocautery? Is that what it's called? Do you use the scalpel from the inside or the top of the skin to cut? Do you feel from the inside of the skin and cut from the inside up? Like, how do you detach the belly button from the skin?
yeah. Okay, that's another really good question, and these are things that we plastic surgeons ruminate over and consider. Um, so when I'm dividing the belly button from the skin, I have to consider how much of a stalk I am leaving. Okay, the belly button, I divide it into two parts: the stalk, which is the tube that goes down to the abdominal wall, the tube,
Mhm.
that you can put your finger in, the tube, and the vestibule, which is the opening. Okay, the vestibule, and the scar that the question's referring to, the detachment from the skin is at that vestibule. We detach the vestibule from the skin around the belly button, and I do it sharply. I do have a device, a Medtronic device that I could do it with. It's plasma. It's they call it the plasma blade, and I've used that before. But in general, I'm going to do a sharp excision with a scalpel. I do cut around the vestibule and detach it that way. And I want to detach it to leave the stalk a little bit shorter than the thickness of the fat layer because I want this, when I sew it back in, I want that stalk to be just a little shorter so that the scar is inside the belly button, not outside.
Mm,
So,
okay.
but the location has to be important. You have to get the location exactly right at the end of the surgery if it's shorter, So, because if it's shorter and it's in the wrong place, oh my gosh, then you're pulling skin, you're pulling on the stalk. So it's a little tricky. But in general, the answer to the question is yes, we cut a circle around the belly button. That's how we detach it.
Okay, because that's that's one thing that I didn't get a chance to view. When you guys recorded my surgery, like I was so excited. I'm like, yes, I'm gonna see, and like I missed that part. So I'm like, man, I didn't get to see like how the belly button is done. So I wanted to make sure I asked that question
Yeah.
today. So then you just touched on the next question: do you sew or glue the belly button? But you just answered that you sew it.
Well, we do sew it at the end of the surgery. So the skin has two layers. Okay, there's the epidermis on the outside. The epidermis is keratin. Keratin's a protein. That's what keeps our body water in and the air out and the bacteria out. It's like a saran wrap keratin. Underneath, the keratin has no strength. It's just basically a watertight seal. Then underneath that, the deep layer of the skin, underneath that epidermis is dermis. Now,
Mm-hmm.
dermis is collagen, which is a different protein, collagen, and that's a strong protein. It holds sutures. So I will, at the end of the surgery, I don't want stitch marks around the belly button. Okay. So I don't put any stitches on the outside, but I will put stitches in the collagen dermis around the belly button and that's the vestibular skin of the belly button. That dermis, I will suture to the dermis of the skin around the belly button. Yes,
Okay. You
the
look,
new opening. Yeah.
you're doing good. Like you're hitting all the questions before I even get to it. This is like so perfect.
All right.
So the next question was, are your sutures done from the inside or the outside? And so,
Okay. So, well, yes, I'm looking on the outside, but I don't want them on the surface. You bury them on the inside. It's a little tricky because the blood supply. Do you notice if you cut your skin very superficially, it won't bleed.
hmm
I'm talking about this, that keratin is designed to resist trauma. The epidermis, the blood is in the dermis. So I put the sutures on the inside, but I don't want to strangulate the blood supply. And that's tricky. That can be tricky. But the answer to the question is the sutures are in the dermis underneath that top layer of skin. But the sutures hold the top layer together by holding the dermis together. They bring the dermis together, the epidermal edge is coapt, and then the epidermis heals and makes a seal around that belly button.
This is really interesting.
Yeah.
Okay. So the next question is, how does one avoid getting an infection around the belly button?
Okay. Well, so I have to tell you, if you get an infection around the belly button, it's we have to be careful during the surgical procedure to prevent infection. And it's unusual for that to become infected after surgery. It's usually something that happens at the time of surgery.
Okay.
Um, and I do two or three things. Number one, obviously, you have to have a sterile operating room. Um, but number two is the patient gets intravenous antibiotics at the very beginning of the procedure. So there's a blood level of antibiotics in the blood at the time of surgery. Number three, during the surgery, I'm irrigating this wound with an antiseptic solution. It happens to be called Iricept from a company called Irimax. It's chlorhexidine gluconate, very dilute. It's a wound antiseptic. So I'll be using that during the surgery in the belly button, around the belly button. But the question is excellent because probably the most important thing to avoid infection around the belly button is a good preoperative skin prep. And the belly button, as you know, it's got these wrinkles and creases and
hmm
nooks and crannies. Sometimes it can be hard to really get that sterilized. And here we are doing this big surgery around the belly button. If that's not sterilized, there's a chance of infection. So we use Q-tips, cotton tipped applicators soaked with the chlorhexidine and alcohol. I use something called ChloraPrep at the beginning of the surgery, and we really prep. And I'm telling you this, Laurice, the belly button, I will prep myself, or I'll have my nurse prep. But there's two areas, and if your listeners should know, the belly button, I soak it with the ChloraPrep. Then I use the Q-tip inside there. I pull on the skin to make sure I've got all the wrinkles inside the belly button, cleaned out as best we can. And the other thing is the tummy tuck is done at the bottom. We want a low scar.
hmm
We have to get the genitalia. This ChloraPrep, we're not supposed to use it on the vagina. Okay, it's an irritant. So, but we can use it on the vulva on the outside. And I really want to prep all those skin creases, what's called the inguinal crease, the front of the vulva, because we don't want those bacteria near in the scar either. So
Right.
so the belly button and the vulva are two areas near the tummy tuck that we absolutely want to sterilize. And that's the main thing we do to avoid infection. Now, after the surgery, your question may come from somebody who maybe there was a little open wound at the edge of the belly button after a tummy tuck. That's not necessarily infection. That could be from the body spitting out, extruding one of those dermal stitches, or and they think, oh, it's infected, but not always. Just because there's an open wound doesn't mean it's an infection.
Okay.
It could be a suture coming out. It could be the blood supply was cut off by a really tight suture and there's no blood supply, so it's not healing well. So a little edge of the part of the belly button opens up. That's something that's wound care. It's an open wound, not necessarily an infection. If it's a real infection, though, it's got to be treated. Antibiotics, drainage, all that sort of stuff.
Okay. Yeah, that's a great in-depth explanation. So I'm sure that will help clear up a lot of the confusion. Okay, so the next question is, are there any creams or ointments that you feel aid in the healing process, or once the tummy tuck is done, like just absolutely leave the belly button alone, like you don't need to do anything?
Um, Well, every situation's different. Okay, the one cream or ointment that's been shown to maybe improve the scarring is silicone, and it's hard to a lot. Sometimes we'll give patients silicone tape for the lower abdomen where the tummy tuck is closed, but
Mhm.
you can't put tape around the belly button. Okay, so there's silicone gel. There's also these little silicone belly button buttons, that you can put inside the belly button if it's shrinking down tight. I want to tell the audience though, if the belly button is shrinking down tight and getting stenotic, what we call a stenosis, you want to get that revised under local anesthesia. You do not want a belly button that closes, okay, because
Mm,
you can't clean it inside. And you want it to look good, of course. So if it's stenotic, sometimes it requires a surgical revision. Will a cream or an ointment prevent that? Probably not. Will
okay.
silicone ointment prevent it? No. But the button might. The little buttons, they make them. You can find them at Amazon or the surgeon. I give them to patients who want them. If the belly button's getting a little smaller or it's too small for them, I'll say, listen, try this little button inside. It's something you wear for a while after surgery. But if the belly button's still getting smaller and stenotic, or they don't want to use that button, that little silicone plug inside the belly button, I will say, okay, well, we just need to do a little surgical revision, a Z-plasty or a little revision to open up the belly button, the opening, the vestibule.
Okay, that was the next question. What are your thoughts on belly button training? Earplugs, marbles, and like you said, the button.
Sometimes you need them. If the belly button's open and it looks good, why put something in there and trouble yourself with that every day? If it looks good and it's open, it's aesthetic, you don't need it. But I think the earplugs and the marbles, the silicone plugs, um, if it's getting stenotic or if it's smaller than the patient likes, that's a non-surgical way to try and open it up a little. And they come in different sizes, so you got to get the right size so it's not just falling out all the time. But you
Mm,
want something that's going to be a little snug. I like the silicone kind. And if the belly button's too small, that's the indication for those devices. But if the belly button looks good, I would say don't bother with it.
okay. Okay. And now our last and final question. Is there, well, you sort of touched
Yeah.
on this too. Is there such thing as a belly button revision? And if so, how is it performed? Do you have to go back under anesthesia? Like you
No.
just give a loco? Like how does that work?
Yeah, local, because it's a very small area. Um, so the answer is yes, there is such a thing as belly button revision. Revisions in general, Lorice, I would say, patients always come for a result, okay? And tummy tuck patients want a beautiful belly. They want a sexy belly. They want to wear a two-piece swimsuit. They want
Hmm.
to love their body. I get it, and pregnancy just does all sorts of things to the woman's belly. So if you're for some reason the belly button is not looking good, I say yes, talk to the surgeon about it. Say, look, this is what I don't like about it. This is what I want changed. Can we do this? And the answer is probably yes. I do belly button revisions like I do a facial surgery, like a nose or an eyelid or lip surgery, very delicate under magnification. I have these surgical magnifying glasses. I'll explain, what we're going to do, and based on what the patient wants, the change they want, how we're going to accomplish that. And that's another reason you want a stalk in there, because you want to preserve enough skin inside the belly button to do something later if it needs to be done.
Mm.
To open it up, to make, say, the scars on the outside and it's visible. Well, we don't want that. So I'll take some stalk out and pull that scar on the inside. That's
Mm.
one kind of revision. Another revision is if it's stenotic, if the opening's too small, do a little Z-plasty, open it up. Another revision is just a nasty scar, a hypertrophic scar. Some people will call it a keloid. It's not really usually a keloid, but a scar that's visible and ropey and firm. That scar should be taken out and try again, revise it, redo it. So
Okay.
the answer is, how's it performed? It depends on what the issue is. You want to perform it to fix the issue.
Okay, awesome. Well, that's all the questions that I have for you today, Dr. Laverson. I really appreciate your time. I know you're very busy, so we really enjoy this and we don't take it for granted.
Well, we're never too busy for Beyond Body.
Oh, thank you, Dr.
All
Laverson.
right.
You're awesome.
All right.
All
Thank
right,
you.
take
All right.
care.
Very good.
All right, guys, you heard it from Dr. Laverson. Today's episode was all on belly buttons. So make sure, if you have any questions, comments, or concerns, or if you have a topic in mind that you want to hear us talk about, please make sure you comment and let us know, because you never know, it might be on the next episode of Let's Ask the Surgeon. Until next time, take care, beauties. Bye.